rights that we take for granted sometimes for us are rights that are denied to so many people who have faced many barriers in accessing services, basic services like health. And unless those specific barriers these people face are addressed, they will never be able to enjoy the type of health and support that is needed for them to have a life of dignity and unlock their potential.
In Kenya, the sexual and reproductive rights health violations that I think urgently need to be addressed are the forced sterilization of women, particularly from marginalized communities, and unsafe abortion as a preventable cause of maternal mortality.
For SDG, one of the most important violations is when young adolescents and young people don't have access to adequate and age-appropriate education and information to enable them to decide freely and responsibly on issues of reproduction and sexuality.
A human rights-based approach is about empowering people to know and to claim their rights, and it's also about increasing the accountability of states to respect, fulfill and protect human rights.
You have to include all groups, all categories, women, adolescent, sex workers, MSM, addicted person. If not, you will never get good result on infectious diseases, on HIV, on hepatitis C.
For us at the Swiss Red Cross, the human rights-based approach is very essential to our work for sustainable development. We consider it utterly important that citizens are empowered in all areas of their life.
NGOs and civil societies play a crucial role in empowering communities and holding governments accountable for their actions.
It's very important for civil society to be able to hold governments accountable at the global level for their human rights violations related to sexual and reproductive health and rights.
We should never forget to synchronize all our intervention and not to work just on the level with the victims of human rights violation. We have to help them to integrate their trauma and then to enable them to claim for their rights. In a parallel way, we should work with the governmental structure in order to enable them to respect the human rights of their citizens.
At the international level, I believe that the United Nations treaty monitoring bodies must come out clearly and aggressively to demand for state accountability for forced sterilization of women. At the national level, we need to demand for decriminalization of abortion to allow for access to safe abortion for all women.
The UPR, the Universal Periodic Review process, is an excellent mechanism for holding governments accountable for their human rights violations. Civil society working at the national level are able to raise their concerns not only with their government, but with every other single government in the world. And when that particular country is going to be reviewed, we can get those countries to raise recommendations about how that government can improve its human rights record when it comes to sexuality, gender, and reproduction. The role of civil society in that process is absolutely crucial.
Well, what would be important is to have a stronger commitment from donors and more systematized synergies to promote the right to health approach.
The network Medicus Mundi Switzerland, with over 50 organizations working in health, supports its member organizations to advocate for better sexual and reproductive health.